I do want to say, though, if we are to reach this level of better collaboration and I believe an effort to really move the Commonwealth forward, we have to deal with Medicaid expansion. Medicaid expansion is an issue that has been important, continues to be important. 82% of Virginians have made their voices heard, have said time and again, for our neighbors and our friends should have the dignity to be able to visit a doctor when they are sick. We cannot continue to put Band-Aids on a system that is simply broken. And we know it's broken. Healthcare costs have been rising because we have too many uninsured individuals in Virginia. And these individuals wait until they are extraordinarily sick to go to the emergency room. The cost of care is very inefficient, it is very high, and the outcomes are not good. They're not the best outcomes we could possibly have. I know there's a constituent of mine in Northern Virginia who did not have insurance, had an infection in his ear, let it go way too long until he could no longer perform his duties at work, went to the emergency room, and ended up, they could not help this man, and he is now deaf, at least deaf in one ear and partially deaf in the other. And that's simply because he could not go to a doctor. There are 32 states that have expanded Medicaid. Virginia is sending $5.4 million a day to these other states. These are tax dollars paid by Virginians going to other states to insure the uninsured, and yet we are leaving our own Virginians out in the cold. We must act to change this, and it's really our responsibility. We're talking about $2.5 billion a year. That's a lot of money in our economy, and new jobs, and these jobs would be spread throughout the Commonwealth, but frankly, they would be in areas that are now suffering from very high unemployment, where coal jobs are going away, where there are no other options for folks. And they would, yet, if we had this Medicaid money, we could create clinics. We could create access points. People could go and get certificates in healthcare professions. This would make a difference. It would make a huge difference. I certainly feel for our senator, our friend from Franklin County, and the hospital in Patrick County that was suffering yesterday and needed action and an emergency clause. But I have to believe that there are other hospitals in the Commonwealth that are in the same situation, are struggling because they have a high uncompensated care load, and yet we sit here and do nothing. We have to stop. It is time to act. You know, Governor Northam, in his inaugural address, talked about giving individuals hope. And here we are. We have the opportunity to give individuals hope. We have the opportunity to do the right thing. We know that providing health care is the right thing. We would not shut our hospital doors because people don't have access to care. We know our hospitals are the safety net. So why don't we try to allocate health resources in a normal way, in a way that makes sense, in a way that keeps people healthy? Ladies and gentlemen, I do hope we can make progress on Medicaid expansion. There are many options out there. We have lots of opportunities to tweak whatever we do, to identify categories, but what we have to do is ensure the uninsured, hardworking Virginians who need insurance. I think if we could work together on that and start a healthy conversation, it would go a long way in helping us be more collaborative. Thank you, Mr. President.